Hi, I'm board-certified dermatologist and skin wellness expert, Dr. Cynthia Bailey, and I'm going to talk today about melanoma. I'm going to talk about what melanoma is, why melanoma happens, who gets melanoma, and how you can try to lower the chance that that's you. Do you know exactly what melanoma is? Or are you using the word sort of like the word Kleenex? I use the word Kleenex when I want a facial tissue. Oftentimes, I'm not actually buying Kleenex brand facial tissues. Are you using the word melanoma to sort of generally refer to skin cancers? It's not exactly a general word for skin cancers, and I'm going to explain to you what all that means. Do you know if you're at higher risk for melanoma? I mean, some people get melanoma and some people don't. How do you assess your risk and the risk of the people that you love when it comes to melanoma? I'm going to explain that. Do you know that melanoma is not actually always super scary? Do you know that when caught early, it's actually pretty darn curable? But it's got a huge fear factor because when you catch or when we catch melanoma late, that's a game changer when it comes to striving for cure. So understanding melanoma, knowing what it is, who's at risk, and how to lower your risk for getting melanoma is actually really important. So let's get you crystal clear on understanding melanoma. First, I want to explain to you what melanoma is. And that means you have to understand melanocytes. So melanocytes are cells in your skin that produce pigment. They are not the main skin cell that makes up your skin. So in this diagram here, the top portion that's sort of purple colored is the epidermis. And the epidermis is made of cells called keratinocytes. The basal portion are basilar keratinocytes. The ones above are called squamous cell keratinocytes. That's the main material that your hide is made out of. Scattered within those keratinocytes are melanocytes, and they are infrequent, but pretty much evenly scattered in your epidermis. They originate uniquely, not from the same place all these purple guys come from. They actually, when you're an embryo, they come from the material that's going to make up your central nervous system. When you're an embryo, you're actually initially composed of 3 different layers of cells. One of those layers becomes your skin, and that's where your keratinocytes come from. Another one of those layers becomes your central nervous system, your brain and your spinal cord. And that's where your melanocytes come from. So they start in the central nervous system layer of your tissue, and during embryogenesis, as your body is forming as an embryo, they migrate to the skin. You also, importantly, have melanocytes in your central nervous system. So you have them in your spinal cord, and your eyes are also derived from the central nervous system, and you have melanocytes in your eyes. That becomes important because not all melanoma comes from the skin melanocytes, and the connection between melanoma and UV is clear and important, but not 100%, because obviously your spinal cord doesn't get ultraviolet light. So what is melanoma? Melanoma is the cancer of the melanocytes. So as I mentioned, the melanocytes are up here in your epidermis, but you also have melanocytes in your dermis, which is the second more orange layer of your skin, in the form of moles called melanocytic nevi. So true moles are growths on your skin where the melanocytes have sort of nested and clustered here, or a combination. Melanoma happens when one of those melanocytes either living singly up here or clustered in a mole, becomes cancerous. So a mutation occurs, a cell loses its ability to play well with others and starts growing as cancers do without regard to the well-being and integrity of the host. Melanoma is not the most common cancer any more than it is the most common cell in the epidermis. So melanomas are less common than the other skin cancers that come from these squamous cells and basilar squamous cells in the epidermis. Basal cell carcinoma comes from the basilar cells, and squamous cell carcinoma comes from the squamous cells. And the precancerous squamous cell carcinomas called actinic keratoses that dermatologists love to burn off with liquid nitrogen come from these squamous cells as well. Those are much more common than melanoma. Now that said, melanoma is still all too common. 1 in 28 Americans will develop melanoma in their lifetime. So that's actually a pretty big deal. The good news is, caught early, the melanoma is actually pretty doggone curable. In fact, the cure rate is 99% when you look at 5-year survival when we catch it early. But what does early and late mean? It's not actually about the clock. It's about the depth of invasion. So when we catch melanoma early, the cells are still way high up here in the epidermis, or maybe just a little wee bit down into the dermis. When we say late, what we mean is that melanoma has gone down and becomes more invasive. When it does that, it's coming into better connection with the highways to trouble. And those are your blood vessels. Melanoma cells can get into the blood vessels and spread to distant parts, and or your lymphatic vessels. It can also track along nerves. So the deeper the melanoma cells are, the more opportunity they have to get into the rest of your body, and that's actually tricky to treat. So they can sit up here in the superficial portion of the dermis and in the epidermis for not very long, or for 20 or 30 years. So it's not about a clock. It's not about how long the cancer's been there. It's about whether it's become deeply invasive. And what determines that is the cellular mutation. So the longer that melanoma sits there, the more opportunity those cells have to mutate in a way that determines they want to go down instead of just sort of sitting here spreading out. So of course, time is of the essence with diagnosis of melanoma, and that's why I want to teach you the warning signs of melanoma so that you can do a better job getting yourself into the doctor if you think there's something funny looking on your skin. And I've gone to work every day with the early diagnosis of skin cancer and melanoma as my almost singular mission. I mean, yes, I like to be good at treating acne and all of the other skin problems that are part of my career, but saving people's lives from melanoma is a really clear hero's mission for me. And so I've made myself really good at it and good at teaching my patients how to partner with me in between their exams to my office so that they and their eyes are on duty when they're not in my office, when my eyes are on duty. So who gets melanoma? Well, in men under 50, it's actually the #1 cancer. In women under 50, they get more melanoma than men do, but it's the #3 cancer because women also get breast and thyroid cancer at a, unfortunately, high rate. I should know, I've had breast cancer, but I got it after 50. Still, men and women under 50 are at risk for melanoma relative to the other cancers that they develop. The highest risk group for developing melanoma, however, is fair or Caucasian men over the age of 55. The fairer your skin is, the higher the risk you have of developing melanoma. Now, that's not to say that skin that isn't fair, meaning non-Caucasian skin, can forget learning about melanoma because, in fact, darker skin types do develop melanoma as well. And unfortunately, for whatever reason, it tends to be more aggressive. It tends to be caught late, which is more deeply invasive, and it tends to be more aggressive. So everybody needs to know the warning signs of melanoma. In addition, darker complected people, when they develop melanoma, are more likely to get the cancer on weird parts of their skin that, again, we don't expect to see melanoma. So palms and soles and mucous membranes. So understanding the warning signs of melanoma and having a surveillance plan or a high index of suspicion for lesions that are odd appearing on your palms and soles or your mucous membranes is important. Melanoma can happen in children as well. It's rare. Only about 3% of all cancers in children are melanoma. But again, for whatever reason, whether it's that we're not expecting it, diagnosis is delayed, or I don't know, we don't really know why, melanoma in children is often very aggressive. So again, watching your child's skin for the worrisome signs of melanoma is important. So what factors in your life may put you at higher risk for getting melanoma? You're at higher risk if you've had a lot of cumulative sun exposure over your lifetime. Day in, day out, year after year, cumulative sun exposure increases the risk of developing melanoma. Your risk of melanoma doubles if you have a history of 5 or more blistering sunburns. And I've got to tell you personally, my childhood was one string of blistering sunburns after the next. And a number of fair-skinned people living in sunny climates have that same childhood history. 5 or more blistering sunburns doubles your risk of developing melanoma. Tanning bed use is linked to melanoma, and this is really important. Tanning bed use is sometimes touted as safe, and it's not. Not only does it wrinkle you like a alligator or leather bag as you get older in life, but it really increases your risk of developing melanoma. The statistics are alarming, and I'm going to read them here so that I'm sure that I give you all the statistics. I really want you to know this. So if you've done tanning before the age of 35, it increases your risk of getting melanoma by 75%. So teenagers and young adults who tan with indoor tanning beds have a 75% increased risk of getting melanoma. Ouch. If you've done it 10 or more times over the course of your lifetime, your risk of getting melanoma is increased by 35%. And another study showed alarmingly that in women diagnosed with melanoma, 97% of them had a history of tanning bed use. Basically, tanning beds, in my opinion, are sad. You're at higher risk of getting melanoma if you have a lot of moles. So most people have a few moles. And the natural history of our moles is we acquire them in childhood and young adulthood. If you have a lot of moles, that puts you at higher risk of getting melanoma. Also, if you have crazy looking moles, which we call dysplastic nevi or atypical nevi, so your moles are crazy looking, and I'm going to explain that in a little bit, that puts you at higher risk of getting melanoma as well. If you have fair skin and light colored eyes, you're at increased risk of getting melanoma, especially if you have red hair and fair skin and or come from a family with redheads in the gene line. So being a redhead means you have 2 genes for being a redhead. You can be blonde like I am, well this is not actually real blonde, but I was born real blonde, or a brunette and have just 1 redhead gene in your genome, in your gene makeup, because we get 1 from our mom and 1 from our dad. So I have 1 redhead gene in my genome, and that gene puts me at increased risk for getting melanoma. So fair skin, fair eyes, and especially red-headed gene in your gene collection increases the risk of getting melanoma. You're also at increased risk of getting melanoma if you have a history of any kind of skin cancer. So skin cancers are linked to UV exposure, and that's a marker for UV exposure. So if you've had a skin cancer of the basal or squamous cell type, you're also at higher risk for getting melanoma. If you have a compromised immune system, you're at increased risk for getting melanoma. So we think that we form cancers all the time in all of our organ systems, the skin included, but our body has a cleanup system. It goes in and it fixes the abnormal cell before it can manifest in a tumor. If your immune system is compromised, for example, you're on chemotherapy, you have lymphoma, you have HIV, you have an increased risk of developing melanoma, or if you've had an organ transplant and are on immunosuppressive medicines. And lastly, family history. So, genes are the new frontier right now. Genes are the gift that keep on giving. And if you have a family history of melanoma, you have a higher risk of getting melanoma. The statistics are actually fairly alarming. If you have a first-degree relative who's had melanoma, you have a 50% greater chance of getting melanoma. In fact, when I make a diagnosis of melanoma in somebody, I say all your first-degree relatives need to go have a full skin exam to assess their risk of melanoma. And I recommend that they have an annual skin exam for ongoing surveillance. In addition, if you in your family have the genetic familial atypical mole and melanoma syndrome, meaning you've got a lot of people in your family with funny looking moles and there's melanoma in the family, that's a big indicator that you're at higher risk for melanoma, and you definitely need to attach yourself to a good dermatologist and have regular exams. There are also gene mutations that are associated with an increased risk of melanoma, and the list is growing. So there's a tumor suppressor gene called P53. If that's mutated, you're at increased risk for getting melanoma. There are also mutations in a gene called BRAF and others. We also now know that people with Parkinson's disease, which can be genetic, are at increased risk for getting melanoma. And there's some increase in the risk of melanoma with the BRCA gene mutation, which I have. Oh yay. So genes are the gift that keeps on giving. They make us alive, they give us life, but they also give us sort of a crystal ball of predictions that can be a little scary at times. And then, as I mentioned before, there's the melanocortin receptor gene in redheads. If you have one of those genes inherited from one of your parents, even if you're not a redhead, you have a 42% increased risk of getting melanoma. So what all those numbers mean and all that scary information means is that if you find yourself fitting into any of that, you need to learn what I'm going to tell you next, which are the warning signs for melanoma, and you need to find a good dermatologist that gives you the time and attention to do a full skin exam. The good news with melanoma is, again, it's really important to focus on if you catch it early, meaning it's up here, we cut it out, ciao ciao bye bye, probably not a problem. If it goes down here, it's hard. There's new medicines coming out that are huge breakthroughs, but still, the difference in survival is all determined by the depth of invasion, and that means you want to know what I'm going to tell you next, which are the warning signs of melanoma. So what are the warning signs of melanoma, and what do you want to look for when you're looking at your own skin? There's a simplified mnemonic that we teach patients to help them remember this, with a few caveats. So there's the A, B, C, D, E criteria that we want you to subject your moles to when you're looking at them. So A stands for asymmetry. We want our moles to be circles or ovals. We don't want willy-nilly shapes. Basically, if your mole is cut in half, does one side look like the other side? That would be symmetry. If it's willy-nilly shaped, that's asymmetry, and that's a worrisome sign. B is the border. We want the borders of our moles to be fairly uniform and crisp. We don't want scallops and notching. We don't want to see the pigment sort of bleeding out and diffusing into the surrounding skin. We want the borders to be fairly crisp and uniform. C is for color. We want our moles to be fairly uniform in color. Now this is a bit of a soft criteria and a little confusing criteria, because if you really look at your moles, probably almost none of them are absolutely uniform, but you want the color to be fairly consistent. Maybe it's darker in the middle and then gets lighter on the edge. Maybe it's darker on the edge, gets lighter in the middle. Maybe it's pretty much even. If the color is speckled and haphazardly arranged, especially if it's asymmetrically haphazardly arranged. That's worrisome. We also don't like to see a lot of red, white, or blue in our moles, so we don't like patriotic moles. And we don't like to see a white halo around the mole, especially around part of it. So if your color's not fairly even and fairly symmetrically arranged in the mole, that's a worrisome sign. D stands for diameter. We are concerned when moles reach the diameter of a pencil eraser, which is 6 millimeters. Now that said, melanoma starts as one microscopic cellular mutation. And so of course melanoma can be smaller than that. But by the time it reaches a diameter of a pencil eraser, you need to, that's a red flag you need to be looking for. And you'll catch the small ones with E, evolution. We don't want our moles to be changing significantly. So if a mole is starting out small and getting bigger, starting out one color, turning into another color, those are evolutionary signs that you want somebody like me to take a look at the mole. Now, that said, the natural history of moles is important to understand. We collect our moles as kids and into our teens, 20s, and 30s. By the time you're hitting your middle-aged years, you actually should have pretty much your full complement of lifetime moles. The acquisition of a mole after that, something that looks like a true mole, meaning a melanocytic nevus created of mole cells, not an age spot, not a barnacle, not a liver spot, but something that looks like one of your real moles. If you're acquiring one of those after middle age, that's worrisome. And remember I said the highest risk group is Caucasian guys over 55. So the acquisition of a new mole later in life is worrisome. Our moles naturally actually regress with age. So when we get them, the mole cells are often here, then they migrate a little bit down here as we go into our adulthood. And then slowly, these mole cells get traded for fat, like a lot of things on our body. Oh yay, nature. And the brown pigment gradually starts to lighten up. So our moles with age, especially middle age, become flabby and softer and less tan. Anything other than that, especially if it's happening on just one mole, we want to see that happening with the whole sort of complement of our physical moles. If it's happening with just one mole, that's worrisome. The other thing is the ugly duckling sign. So we pretty much have a pattern to our moles. Some people have cappuccino colored moles. Other people have little espresso moles. Other people have red moles, reddish orangish moles. So if you have a mole that all of a sudden doesn't look like everybody else, that's an outlier. It's an ugly duckling and it needs to be checked. And then there's the elevation, firmness, and growth. So again, moles shouldn't be hard. If you have a mole that's firmer and bumping up and is growing, that's worrisome and you should bring that to somebody like me. And then blue-black. Again, I said we don't like red, white, and blue moles. We don't like blue and black in our moles. So blue and black are often indicators that the pigment down here is being created abnormally and it reflects up to the eye as a blue or black color. So blue or black, you want to bring it into somebody like me and make sure that it's fine. And then when a mole is worrisome and you're seeing your healthcare provider, if you really feel like this mole is making you nervous and they're telling you, oh, it's fine, let's watch it, I encourage you to poke a little bit because there's just so many stories of, the provider, the healthcare provider looking at it out of, on a single visit out of context and thinking, well, it looks okay. But your intuition, you know if it's worrisome to you. And I can't tell you the number of times I've had patients come in and point out, I'm worrying about this mole for some reason. 2 times I can remember over my career, I had mole photography. We pulled out the photo. Nothing visual to the naked eye had changed. But the patient, this is worrying. One back here, this one's itching for some reason. And for me, again, I go to work trying to make sure that I don't miss these things. So my motto is better in a bottle, better in a histopathology bottle sent down to a good histopathologist, because my eyes are not a microscope. And so I've had enough experience where the patients knowing being the indicator for biopsy saved their life. Melanoma developing within a mole, which brings me to another important point, and that is that most melanoma doesn't actually come from an existing mole, it comes from a brand new mole. So again, we collect our moles in our teens, 20s, and 30s. The acquisition of a mole after that seems like a new mole that's growing is a warning sign for melanoma. So most melanoma comes de novo from a melanocyte that's not included in a collection of nested melanocytes in a melanocytic nevus. So the acquisition of a new mole, a change in an existing mole, sort of weird intuition that you have about a mole, even if it doesn't yet look A, B, C, D, E, ugly duckling, E, F, G, or blue-black, advocate for yourself. Because when we catch melanoma early, ciao, ciao, bye-bye. Cut it off, good prognosis. When the melanoma becomes deeply invasive, it's a game changer. And the last point I want to leave you with is prevention. In addition to understanding the A, B, C, D, E, and other signs that are worrisome for melanoma and doing your own self-skin exams in between having your skin examined professionally, I want you to get really good with sun protection. 86% of melanomas are linked to ultraviolet radiation exposure, either sun exposure or tanning bed exposure. So melanoma is not entirely, but largely a preventable disease, just like lung cancer. Not all lung cancer, but most. So by protecting yourself from ultraviolet radiation, getting really, really good at enjoying the outdoors, having all the fun that you want outside without letting the ultraviolet radiation hit your skin to begin the cascade of events that leads to melanoma is important. You need to become a pro with sun protection. And so I invite you to look at my sun protection page where I've written it out and or watch my upcoming YouTube video on sun protection. So the good news about melanoma is if we catch it early, it's curable and it's preventable with good sun protection. The bad news is it still exists, it's not all that uncommon, and you do need to become a pro with detecting it early. So thank you so much for listening. If you found this helpful, I do really appreciate those thumbs up. And I invite you to subscribe to my channel so that you don't miss the videos that I'm putting out, because some of them may be of interest to you. So thank you very much. Have a great time in the sun. Bye-bye.